Hello, my beloved viewer. Welcome back to Re the Explorer, Life and Learning Hub. Today we're exploring a skin condition that most of us experience at some point in life: acne. Acne can affect anyone: teenagers, adults, men, and women. But here's the important thing: acne is normal, and more importantly, it's manageable. In this video, we'll explain what acne is, why it happens, how to treat it, and how to take care of your skin with confidence and care. Let's dive in. Section 1. What is acne? Acne is a common skin condition that occurs when your pores become clogged with oil, dead skin cells, and bacteria. It often shows up on the face, chest, shoulders, and back, where oil glands are most active. Beneath your skin are tiny oil glands, called sebaceous glands. These produce sebum, a natural oil that keeps your skin and hair hydrated. Normally, sebum travels up through your hair follicles and exits through your pores. Along the way, it helps remove dead skin cells. But if your body produces too much oil or sheds too many skin cells, the mixture can clog your pores. This creates the perfect environment for bacteria to multiply. The clogged pores become inflamed, and that's what leads to pimples, whiteheads, blackheads, and more. Section 2. Who gets acne and why? Acne affects up to 85% of people between the ages of 12 and 24. But it doesn't just affect teenagers. Many adults, especially women, continue to get acne well into their 30s, 40s, and beyond. Let's look at some of the common causes. First, hormones. During puberty, the body produces more androgens, like testosterone, which stimulate oil glands. Hormonal shifts also occur during the menstrual cycle, pregnancy, menopause, or when starting or stopping birth control. Second, genetics. If your parents had acne, there's a good chance you will too. Your genes affect how much oil your skin produces and how it responds to inflammation. Third, bacteria. The skin naturally hosts bacteria, but when pores are clogged, bacteria can multiply and trigger inflammation. Fourth, medications. Some drugs, like steroids or lithium, can cause acne as a side effect. Fifth, lifestyle. Poor sleep, chronic stress, and a diet high in sugar or dairy may contribute to breakouts in some people. While research is ongoing, there is some evidence linking high glycemic foods to increased acne. Section 3. Types of acne. Not all acne looks the same. Identifying the type of acne you have helps determine the best treatment. Whiteheads are clogged pores that are closed under the skin. They appear as small white bumps. Blackheads are clogged pores that remain open. The trapped material darkens when exposed to air, turning black. Papules are small, red bumps caused by inflammation. Pustules are similar but filled with pus. They often have a white or yellow center. Nodules are large, hard lumps beneath the skin's surface. Cysts are similar but filled with pus. These are the most painful and often lead to scarring. Some people may also experience fungal acne, which is caused by yeast rather than bacteria, and requires different treatment. Section 4. How to treat acne. Let's break down the treatment options, starting with mild acne and moving toward more serious cases. Mild acne, over-the-counter products. Several effective products are available at most pharmacies. Benzoyl peroxide helps kill acne-causing bacteria, reduce excess oil, and remove dead skin. Salicylic acid clears out clogged pores and helps prevent blackheads and whiteheads. Alpha-hydroxy acids, such as glycolic or lactic acid, exfoliate the skin and promote new cell growth. Sulfur is another ingredient that helps dry out excess oil and remove dead skin cells. These treatments work best with consistent use. Start with one product, use it as directed, and be patient. It may take several weeks to see improvement. Moderate to severe acne. Prescription treatments. If over-the-counter treatments aren't helping, it's time to see a dermatologist. Topical retinoids, derived from vitamin A, help unclog pores and promote skin turnover. Topical antibiotics reduce inflammation and target bacteria. Often, they are combined with benzoyl peroxide. Oral antibiotics are prescribed for more severe cases. They work by reducing bacteria and inflammation, but should only be used for short periods. For women, hormonal treatments such as birth control pills or spironolactone can be very effective in reducing oil production. Isotretinoin, often known by the brand name Accutane, is used for severe or cystic acne. It's powerful and can produce lasting results, but it requires close medical supervision due to its side effects. In some cases, corticosteroid injections can be used to reduce inflammation in large, painful lesions. Section 5. Building an acne-friendly skincare routine. No matter what treatment you use, having a daily skincare routine is essential. In the morning, wash your face gently with a mild cleanser. Apply an oil-free moisturizer. Use a non-comedogenic sunscreen. At night, cleanse again. Apply your treatment product, whether it's salicylic acid, benzoyl peroxide, or a prescription cream. Moisturize again, especially if your skin is dry or irritated. Choose products labeled oil-free or non-comedogenic, meaning they won't clog your pores. Avoid harsh scrubs, alcohol-based toners, and overwashing. These can damage your skin barrier and make acne worse. Don't pop pimples or squeeze blackheads. This can cause infection, inflammation, and permanent scars. And always remove makeup before sleeping. Even oil-free makeup can block pores if left on overnight. Section 6. Acne and mental health. Acne affects more than just your appearance. It can impact your mental health, your confidence, and your daily life. Many people with acne report feeling anxious, embarrassed, or even depressed. If you've ever avoided social events because of a breakout, you're not alone. But acne doesn't define you. You are not your skin. You are not your blemishes. Celebrities, influencers, and everyday people get acne too. And they're sharing their real, unfiltered stories. There's a growing acne positivity movement, encouraging people to show their true skin and support each other. So remember to treat yourself with the same care and kindness you'd give a friend. In summary, we've discovered that acne is prevalent among various individuals, resulting from clogged pores filled with oil, dead skin, and bacteria. Various factors like hormones, genetics, and lifestyle choices contribute to its development. Understanding the range of treatment options available, including gentle cleansers and prescription medications, is essential. Maintaining a consistent skincare regime can significantly improve outcomes. Above all, it's crucial to remember that experiencing acne does not diminish your value or self-worth in any way. Additionally, a strong support system can greatly enhance your journey toward clearer skin. It's about embracing self-love and finding confidence beyond the surface. In conclusion, while the journey to managing acne may involve various challenges, it ultimately serves as a testament to resilience, self-care, and the importance of nurturing our self-esteem. Embracing our unique imperfections invites a deeper understanding of beauty, both inward and outward. Conclusion. Your skin is on a journey, and so are you. Whether you're trying to prevent breakouts, treat existing ones, or heal from scarring, the path to healthy skin takes time, patience, and care. There's no quick fix, but with the right information, support, and products, you can improve your skin and your confidence. Call to action. Thank you so much for watching. If this video helped you, please like it, share it with someone who might benefit, and subscribe to the channel for more educational content every week. Check out the video description for a special discount code on Pictory AI, the tool I use to create this video. It's great for turning your scripts and ideas into powerful visual content. Let me know in the comments how your skincare journey is going. I'd love to hear from you. This is Ree the Explorer, signing off. Stay kind, stay confident, and take good care of yourself. Your skin's appearance should not determine how you feel about yourself. Acne is normal. This video is for educational purposes only and does not replace professional medical advice. Always consult a healthcare provider for diagnosis or treatment of any skin condition.